Bag mask ventilation is a critical airway management skill in both controlled and emergent medical situations. Choose a face mask that best fits your patient. The mask should cover the bridge of the nose and the entire oral aperture. A mask that fits well forms a seal with the facial tissue. If the mask does not form a seal, add air to the inflatable cushion rim to create a better seal. Prior to applying the face mask, ensure that the bag is connected to an oxygen source and that you are delivering high-flow oxygen, 10 to 15 liters. Place the patient's head in the sniffing position to maximize the airway diameter, and thus the ability to ventilate the patient. This is done by gently tilting the patient's head back with one hand and extending the neck. Simultaneously, the index and second fingers of the opposite hand are used to lift the chin. Apply the face mask to form a firm seal on the face. One of the most difficult yet important skills for mask ventilation is correct hand placement. Position the left thumb and index finger around the top of the mask such that they make a C. These fingers apply firm, but not excessive, downward pressure on the mask's surface. The third finger is placed under the mental prominence of the jaw to bring the jaw upward into the mask, using only gentle pressure. The remaining fingers may be used to secure the mask by applying gentle pressure along the angle of the mandible at the bony prominence. Care must be taken, especially in small children, not to apply pressure over the soft tissues of the submandibular space, as this may occlude the airway. The right hand is free to apply pressure to the oxygen reservoir bag. Observe the patient for adequate chest rise and auscultate both lungs, listening for equal and bilateral breath sounds. Monitor the pressure manometer attached to the oxygen reservoir bag such that you are delivering an appropriate amount of pressure to the patient. This will vary with each patient, depending on their size and lung compliance. Too much pressure may result in barotrauma and a pneumothorax, while too little pressure will result in underventilation. It is rare to ever require more than 25 centimeters of water. If you have a difficult time ventilating a patient, consider the following adjustments. Reposition the patient's head to ensure it is in the sniffing position. Apply gentle downward pressure on the mask with the thumb and index finger. Excess force can collapse the airway. Apply pressure with the fifth digit at the angle of the mandible. Partial dislocation of the jaw can move a collapsed tongue out of the airway. If repositioning is ineffective, or if another person is available for assistance, perform the two-handed technique, in which your right hand becomes free to hold the mask in the same position as your left hand, mirror image. The second person can then apply pressure to the oxygen reservoir bag.